BSc with Physics and Mathematics. Graduate with a BSc degree of IGNOU or any recognized open university with a minimum of 32 credits of Physics and Mathematics as one of the subject. So if you are a science graduate who want to pursue a master's degree in physics and aspire to be a physics teacher at the high school, college or university level, if you aspire to be a researcher in frontier areas in physics leading to a PhD in physics or as a scientist in national laboratories or industry, if you want to attend professional growth through higher education, then this program is an excellent opportunity for you. For more information, you may write to us at mscph@ignou.ac.in or call us at the given number. Thank you and best wishes.
Welcome learners, listeners, research scholars and IGNOU fraternity. Today we welcome you for an interactive session on gender and public policy. We have with us the expert Ms. Urvashi Prasad. She was a director in the office of the Vice Chairperson of NITI Aayog, the Indian government's premier policy think tank. She is currently the British Council's UK Alumni Ambassador for SDG 10. She has extensive experience in health, nutrition, sanitation, gender and public policy. Ms. Urvashi is the only lateral entrant professional who has worked directly with all three vice chairpersons at NITI Aayog. She has been part of the core team supporting the work of the Government of India's Empowered Group 1 for managing the COVID-19 pandemic in India. Urvashi co-authored India's first voluntary national review presented at the United Nations High-Level Political Forum on Sustainable Development in 2017. She has over 100 publications to her credit. Urvashi is the member of the World Economic Forum's Expert Network. During 75 years of India's independence, she was recognized as one of the 75 Indian achievers in the UK Parliament. She has also been recognized as the one of the 25 most influential women in healthcare and the 100 most influential women in India. She has been included in Business World Magazine's 40 under 40 list in healthcare. She has completed a BSc in Life Sciences from University of Birmingham, UK, followed by an MPhil in Bioscience Enterprise from the University of Cambridge and MSc in Public Health from the London School of Hygiene and Tropical Medicine. She will give a talk on gender and public policy, focusing on health, sanitation, SDG, among other themes. In the past, we celebrated Swachhata Abhiyan. This month is also month for breast cancer awareness. We all know that 15th October is the World Hand Washing Day. Therefore, we need to discuss about gender, health and public policy in the contemporary discourse. Her talk primarily focuses on gender, health and women's health. When we talk about women's health, it has to go beyond just reproductive health. For a long time, women have only looked at from the reproductive perspective. women's health include reproductive, maternal, mental health, and disease like osteoporosis, cancer, heart disease, and many other things. In all these things, women are equally or disproportionately affected. Reproductive health is essential, and we cannot disassociate women from reproductive health. It is not only one dimension. As far as menstrual hygiene is concerned, we have to go beyond making hardware like toilets at schools and houses. We need to look into the software aspects like behavioral change, menstrual hygiene management, and ongoing maintenance of hardware to know whether it is functional, which is also very essential. Now, may I request ma'am to give a talk on gender and public policy with a focus on health, SDG, and hygiene. Please, ma'am.
Thank you very much, and it's a pleasure being here. So the topic given to me is gender and public policy, and like you outlined, that it is a very complex issue and it has many different dimensions to it. So I'll touch upon few of the key dimensions that I feel need to be spoken about when we look at this issue. So firstly, I think on health, it is true that we still have a lot of unfinished agenda when it comes to reproductive, maternal, child health. We are still grappling with the big challenge of anemia. In fact, if you see, a large number of girls and women in the country are still anemic, even though we've made progress over the years, but it's clearly not adequate. So I think that piece of work is still very much a priority and has to be one. And I think we have to really try and identify those states and districts in India which are lagging behind. So I think for this, we need a very disaggregated approach, and we need to look at data and see, which are the parts of the country that are really lagging behind, and how do we intensify our efforts there. Because I think the government over the years has launched a lot of schemes, programs, but somewhere they need to be implemented in a very cohesive manner, especially in areas that we are particularly lagging behind. So I think that is one thing we have to do. And also we need to look at constituencies within women. Because women, when we say women, it's not a homogeneous group. There's lots of different vulnerabilities that come alongside being a woman. It could be because of caste, it could be because of religion, it could be simply because of your socioeconomic status, it could even be age. You could be an older woman who's lost her husband, for instance, yes, and you could be very vulnerable. So I think vulnerabilities amongst women with disability, have added layers of vulnerability. So I think we need to really look at a disaggregated approach for each of these groups or constituencies, and not look at women as like one homogeneous, bucket, because that's not the case. So I think that is definitely there when I speak of health. But as you mentioned also in your introduction, that the big agenda now for us is non-communicable diseases. And we are talking about breast cancer right now, but that is something that is a problem for us, even if we are not celebrating it or marking it as an occasion, but that's a problem that women are facing every single day. And cervical cancer, various other kinds of cancers are also on the rise, of course, not just for women, also in men. But again, like I said, with women, you have unique hurdles that come in terms of social stigma or in terms of simply cultural social barriers as to why women don't get themselves screened for cancers, don't get themselves tested regularly. And also, I think a lot of women tend to neglect their own health, because they are always the caregivers. They are always looking after their families and their children and their spouses and parents. And somewhere in all this, they miss, looking after their own health. So I think for those reasons, non-communicable diseases is now becoming a big challenge for us. And that also includes mental health. Because again, women have a lot of very unique mental health challenges. And that is partly because of the whole social dynamics, that the kind of issues women face might not be and are not, from whatever research we have, the same as men. They are quite different. So I think that part of women's health needs to be now given more attention. And I think there has been some shift in the policy space, if I see over the last several years. But clearly there's a need to do more. Clearly we are not there yet in terms of fully implementing all those programs that we need to do. So I think that is one, major piece when I talk of women and policy, is the whole health and nutrition piece. Then, of course, I think a lot of it also comes down to women's agency. And by agency, I mean, to what extent women are empowered to take decisions within their households, for themselves, what choices they want to make with respect to their reproduction, for instance, when do they want to have children, if they want to have children. I think all of these are huge factors which are ultimately also linked with a woman's health. So if I look at the issue of, say, intimate partner violence, sexual violence against women, it's a huge challenge still in our country. If you look at the National Family Health Survey, we still have a very, very sizable number of women who are actually experiencing this kind of violence. And so that ultimately, if you think about it, that has a huge impact on all aspects of their health, especially their mental health. So I think, yes, we've made some progress in terms of, say, having women, own more bank accounts. So we've done better now in terms of financial inclusion. So we've given women, more empowerment in some aspects. But I think we still have a long way to go when it comes to really addressing their issue of agency and how they can make choices for themselves, because there's a huge barrier to overcome. There's lots of patriarchal mindsets that we have to overcome. So this is not something that is easy to do, and so we do have a long way to go in that. And I think, in fact, if you talk of the SDGs, we have an SDG index that we would come out with at NITI Aayog, and in fact it's available on the website for anybody who wants to look at it. And you will see that actually gender equality, which is goal number 5, is where pretty much all states, barring very few, have actually been doing very poorly. So it is a clear indication that across the board, gender equality is a big challenge. And if you look at the kind of indicators there, they span everything from women's economic empowerment to health to agency. So all sorts of different things are there. And yet we find that the majority of states are not doing as well as they should be, given that 2030 is now not that far away. So I think that we have a long way to go. We are implementing a lot of initiatives, but there needs to be a very strong multi-stakeholder collaboration in this, because like I said, when you have such strong patriarchal mindsets to fight, only the government alone can never be able to make that full difference. So you need the private sector, you need corporates, you need civil society, and you need citizens themselves to, talk about these issues. How many of us really ask the women in our families that, have you gone for your screening? Have you gone for your regular health check? Are you taking some days off for yourself? So it can be something as simple as that. And I think change has to begin with each of us. Only then will we be able to really address this whole issue. And I think, finally, I would just say that it is very important to understand that we are investing in women and girls, not just for, say, humanitarian or social reasons, right? Because obviously there's social justice elements to that, but also for economic reasons. We are talking of Viksit Bharat at 2047. We are talking of becoming a developed country, and we are not going to become a developed country if 50% of the population is going to be left behind. So even if you're just thinking about it from a pure economic point of view, it is essential that girls and women progress and are able to make an equal contribution to society. So I think that point, while it might seem like an obvious point, is something that still a lot of people don't really fully understand. Even, just a quick example would be that in the private sector, A lot of companies still feel that, oh, if we hire a woman employee, then we have to give her maternity leave, and she's going to go away at some point to raise her children, and so it's a waste to hire a woman employee. But actually, if you look at the research and you look at the data, you will realize that companies which have more women, companies which have more women on their boards actually do better. They are more profitable, they are more successful. So I think that is very important to understand, and also make others understand that even if all you care about is economics, even then you have to invest in women and girls. So I'll stop here. Thank you.
Thank you, Ms. Prasad, for invoking some of the important issues in the context of gender, public policy, and in the contemporary discourse. And you have touched upon some of the key concepts, or what we would say issues, right from implementation of gender-just policies. That is one of the important aspects of women's empowerment when we are speaking about bringing gender transformation or gender transformative justice, and we are talking about women's agency, choices, and decision making. So what kind of policies do we need? And we have gender-just policies, but how do we implement it? That is one of the significant aspects. Second, certainly when we are looking at women's health, we need to also go beyond reproductive and maternal health. Even you mentioned about in your talk on Viksit Bharat and the SDG report 2023-24, which also gave importance to maternal health, because it is one of the important area. Along with this, the non-communicable diseases, which is very important, whether it is osteoporosis, cancer, heart disease. So when we are talking about like women-specific illness, yes, there are certain women-specific illness, and it has emerged from their social disadvantage position. And another aspect we would like to, you brought about very importantly is the cultural factors. Certainly, like even going for screening at a time, right? Whether women themselves are aware of the screening is the first thing. Second is that since they have enormous amount of care work or the reproductive burden, and along with the productive role also they are playing in the contemporary times, it is very important for us to look at that how culturally or socially are we aware to make women in the family or within the household or within a particular working space, that is it possible for them that they can go for regular screening for non-communicable disease. And the last point is when we are looking at SDG, Sustainable Development Goal, and how do we achieve the gender equality. And in this, certainly one is the synergy. There are multiple stakeholders here. State is one of the key stakeholders. Along with the state, you have civil society organizations, you have the public sectors, you have the private sectors, and here the synergy between the local and the global is also very important, as well as the synergy between the rural and urban areas, because whenever we are talking about bringing gender transformation, we also have to look at the geographical differences and how intersectorally or in the context of intersectionality it is going to impact the overall or the development or of women, or the impact of development on women. And so it in a way it is going to look at that how comprehensively that we are going to look at it. And with this, maybe we can open our discussion for a interactive session. So maybe we can start with us, and then we may request our audience to start the question, answer. So maybe we can, like, I have a question that we can start with the question that when we are looking at women's health, how are we going to look at adolescent health here? Because unless and until we look at adolescent health in the context of gender empowerment, where your reproductive choices, then the agency, decision making, these issues are very important, and very much it is embedded in a patriarchal conditions or within the household, right? And the household itself is not egalitarian in nature, right? So how are we going to address the issue of adolescent health, if you could answer?
Yeah, sure. So, when we talk of health or we look at any of, these interventions, we always look at it as a life cycle and with some critical windows of opportunity, right? So actually we start off, if you look at the child, then right from zero, we have a very critical window of opportunity till about 3, which we say is the first 1,000 days, the golden, kind of period where you can really make a lot of difference if you can lay a strong foundation for their health, for their nutrition. So I think that is one critical window. Then we get another critical window, as you said, during the adolescence. That is yet another period where we can make a lot of difference in terms of laying the foundations of good health and nutrition. And I think some of the key issues there right now facing us, of course, we have, the challenges that I mentioned already in terms of anemia, etc. But we also have a big problem of overweight and obesity. And this is, of course, affecting young boys and girls. But certainly, in some states, we see that that's a much higher number of young girls who are actually being affected by this. And we know that, if you're overweight or you're obese right from your adolescence, you're probably invariably, going to develop some sort of heart disease or diabetes or some issue or the other later on in your adult life. So I think that is one huge challenge facing us right now. The other is the whole mental health aspect. And like you said, with girls, it becomes much more complicated because there's household dynamics. They might be seeing violence at home. So many young girls, they end up seeing their mothers being ill-treated or other women in the household being ill-treated, and they grow up, in that kind of environment. So I think with young girls, that whole aspect of mental health becomes even more complicated. Then there are issues that, I've worked on school health programs, and I used to see that even the intra-household, kind of distribution of food is a big problem. Sometimes there's enough food in the household, but you'll have the girls and the women consuming it right at the end. So in fact, a lot of young girls would raise this issue when I would visit schools that, we have food, but we only get to eat it right at the end. By which time, only leftovers are there. So I think these are some very unique issues that, are facing girls, which might not be facing the other gender so much. And so I think we have to have a very strong school health program. And I think that is something that I've been advocating for and working on that for well over a decade now. But now finally it seems that it's, gaining some traction, in the policy space. And we are talking about a national school health program because I think a lot of these issues could be tackled through that. I mean, that's not the only platform, but that's a very important platform. The second platform, I think, is the health and wellness centers that have been set up under Ayushman Bharat. But they really need to be operationalized. I don't think they have been operationalized fully in many states. And if they are fully operationalized, then I think they can play a very important role. And we can almost have this partnership between the Health and Wellness Center and the schools to really address a lot of the adolescent health, nutrition, even other challenges, even mental health or even other lifestyle issues. So I think that is a very important platform. And I think third issue, that major bucket of issues that I think is affecting, of course, it's affecting, boys also. but I think it's equally affecting young girls, adolescents, women, is the whole digital, phenomenon. And that has a very complex intersection with mental health, because a lot of children, adolescents, they are just hooked on to these digital devices, and so that element of human interaction, that element of really raising your problems with other people in a social community sense, that is to a great extent not happening now, because children, young people, they just jump onto their devices. So I think we need to, of course, there's a great benefit to digital, but there's also downsides, and I think it especially affects our young people. So we need to also manage those downsides in a very sensible manner.
Okay. Thank you. And
thank you, ma'am. Actually, I would like to ask two questions. One is related to health, another one is related to public policy. You are part of the premier policy making body. How far that entire policy making body is sensitive, gender sensitive, specifically gender sensitive? Will you able to share your experience, how far you could able to intervene to bring the policies in a gender sensitive manner?
So I think I always say that, change has to begin with yourself. And so I think for that, firstly, we'll have to change in the government itself, because still a lot of women are not reaching senior positions, and while you have a lot of women at the entry level or even up till, say, the mid levels of the organization, you will see very few women at the senior decision-making level. So I think, you need to start changing from yourself, and you need to first implement, practice what you preach, I guess, is the best way of putting it. So I think that is, change is happening there, but I think it's very slow. It's very, very slow if I look at it, because I come from a family of IAS officers, and I've seen that hardly any women, even make it to the secretary level. Very, very few. You can just look at all the batches and you will be able to see. So I think that change firstly has to come. Because if you don't have more women in senior positions in policy making, then how will you really make those gender sensitive policies? Because you can't always have men talking about issues like menstrual hygiene or pregnancy, or they've never even had any experience of it. So I think that is a very big challenge that we still need to overcome. But I think shifts are happening, and when I was working, at NITI, like I said, I tried to push on a lot of these things, that women's health has to be more comprehensive. It cannot just be so limited. You cannot just see women as reproductive, childbearing entities. They are so much more than that. And so I think that shift is happening, but it's slow. And like I said, that in India, because we are such a complex federal structure, it's not so much what the central government is doing, but what the states are doing. And I think most of the action in India lies at the level of states. So if we really want to move the needle on policy, then of course we have to, work at the central level, but equally we have to work at the state level. Because sometimes the center might come out with very good legislations or policies or frameworks, but we find that they don't really get implemented at the last mile. So I think a lot of our engagement has to be at the state and the sub-state level, because the center to a large part just provides you those broad frameworks and, those broad guidelines. But implementation is done by the state level and sub-state level, actors. So we really need to engage with them if we are to truly, meaningfully change the public policy space with respect to gender.
Second one is also related to public policy. The criticism about the government is that they are when you look at every budget, percentage for health and education is always very less. Is it not possible to increase the budget allocation? Where are we failing?
Absolutely. I mean, you couldn't find a bigger advocate for that than me. And I think we've had a chronic neglect, and I say this that it's across governments, I really don't want to pick any one government, But I would say across governments, we have just not invested, the way we should. And, even now, if you look at in terms of percentage of GDP, it's really minuscule. I mean, look at how large a country we are. And we are really at very, very small numbers even now, even though we say, okay, we've increased over the last several years, but that increase is just so inadequate. So I think definitely we need to put our money where our mouth is, and we definitely need to increase budgets at the central level, and also, of course, states which are lagging behind, they need to do that. And I think that comes to the point that I was making, that, we sometimes don't see the value in investing in these areas. We almost feel like, okay, let's invest in defense, or let's invest in, roads and highways. And people don't realize that what's the use of those roads and highways if you don't have a healthy, educated, skilled workforce. Right? So that's why I was trying to link it up to the economic dimension, because that's very important. To say that if our aspiration is to be a developed country by 2047, then we have to invest in the workforce. We have to invest in the quality of the workforce. And think about, if any of us are sick or unwell, can we work? Can we study? We can't. So these are basic things which I think, need to be really imbibed into our policy-making ecosystem. I see some shifts. I wouldn't say that I don't see any positive shifts. I do. But, we are a large country. So we have a long way to go in terms of implementation, in terms of taking these words into action. So I think that is very, very important. And even the gender budgets, I think often we say, okay, gender budgets, we've allocated this much. It's all about the implementation. Ultimately, what do you do with those budgets? Are you really even utilizing them? If you will see that a lot of those budgets year on year go unutilized. So then there's no point, simply allocating something that you're not even using. And you're not using because of poor planning, essentially. It's not because the need is less. The need is huge, because a lot of people ask me this, that, budgets are underutilized, and so therefore the allocations don't go up. And I said, well, that's mostly poor planning. That's not because the need is less. The need is tremendous. And so I think definitely we have to increase our budgets. That is not to say that we don't have to improve the quality of our implementation, because a lot of people say that, money is not the answer. Whatever money you have, you just implement that well. I said, part of it is definitely that. But part of it is also the sheer funding you put into something. Look at our public hospitals, public staff. If you don't have the kind of money to put behind all of that, then it'll be very difficult to even implement something which is of any quality.
Thank you. Thank you, ma'am. And now we can request our audience, and we have research scholars of School of Gender and Development Studies, and they have some queries and questions and interventions to make. So I would request our scholars to initiate the discussion.
How can we educate about mental health, stress, anxiety, depression, and body image concerns at school level?
Yeah, absolutely. I think that's a huge thing, as I've been also talking about, that it's a big concern. And also in this digital age where, like I said, we might be talking to our friends less or to our parents less, and actually, be on our devices more. So that comes with a lot of problems. And I think part of this worsened during COVID, when we had the lockdown and everything. So we couldn't even really socially interact in that way. So I think we have to be very careful of this whole digital aspect, but also, like you said, body image and all those kind of issues. Again, with the internet, with the social media, I think you're constantly comparing yourself with somebody else. And so that can itself lead to depression, that can itself lead to you going in a spiral where you feel that you are so insufficient. So I think this needs, like I said, a comprehensive school health program would address a lot of this. You also need trained, counselors for children, for adolescents to address these issues. There are some schools which have now started even having these mental health counselors come, every week, or they're regularly stationed so that children can share their concerns with somebody who's trained to handle all of this, because often teachers are not, to be fair to them. Sometimes they struggle to, handle all this whole host of issues that now young people are coming up with. I know of a lot of young children below the age of 10, and you might be surprised, who have issues like, OCD, obsessive compulsive disorder. Earlier, I think we would never think of, finding children so young with these kind of issues. So I think we need also a trained workforce to handle all of this, especially at the school level. And then I think we need to really engage parents. We need to tell them that you can't just give a device to your child or a tablet to a child who's crying and say, okay, here, just take this and go away. You need to really engage with your children at home. You need to understand what issues they are going through. And of course, we need to also build peer networks, because a lot of times you can't talk to your parents, but you'll talk to maybe a friend, or you'll talk to somebody who you trust. So I think those adolescent, or even young people, just having those peer networks, that community support is very important. And I think overall we need to have a conversation on mental health regularly. I think one of the things that happened post the pandemic was that we did start talking about mental health more openly, but I think that has to sustain, and somewhere that stigma has still not fully gone away, where people don't really want to seek help for mental health issues. So I think that needs a very broad engagement at the societal level, at the level of media. Everybody needs to come in and say that it's not a something to be ashamed of. If you feel you're having an issue, then you must seek help. So I think all of those components need to go together if we are to handle this very, very complex issue.
Ma'am mentioned a key phrase, critical window of opportunity. It is indeed one for India at the time, with our vision of being a developed country and as a multiple trillion economy. How do we balance our increasing economic might with equally or perhaps more increasing economic disparities?
Yeah, very important issue, of the inequalities. I think, we are still a very, very unequal country. We at one end, you can literally get the best of services. And we do have, even in healthcare, if you see, you have people coming from all over the world to, get procedures done here, because the waiting times are actually less. The quality of doctors is very high. So on the one end, that's an India that we can experience. But on the other end, for a lot of people, a very, very large number of people, it is still, things which are out of reach, and these are still things that they can only dream of. So I think addressing that inequality is absolutely essential, because, we cannot keep worsening that divide, because ultimately it's also going to lead to a lot of social unrest, because you can imagine that if some people are really getting ahead, getting all the luxuries, getting everything in life, and then there's a large chunk that's not getting even the basics, then you can see that, that unrest is going to start to really get problematic. So I think, yes, of course, we have to focus on economic growth. We have to focus on our GDP, everything. But like I said, it cannot be at the cost of leaving some people behind. And that is why, even the SDGs, right? What is their motto? They say, leave no one behind. Because that's really important. You cannot just have development or economic growth for a handful. So I think that is something that through our public systems, public health, public education, that's why I said we need to also put money into these. Because if we can strengthen these, then we can at least ensure that every child in the country has basic, good quality education, basic good quality health and skills. After that, I think, most of the children, they will do very well for themselves. Yes. But they at least need to have these basics, which really many children even now, even if you look at education, you have these surveys that we do from time to time where we see that children have moved to very high grades, but they don't even have the basic skills. Basic literacy, numeracy skills are not there. So, you might have somebody passing out of school and they might not be able to do very simple maths also, or, speak some basic language. So I think those are the kind of issues that really pose a challenge mostly for our public health system. and for the public education system. Of course, like I said, because we're such a large and complicated country, it's very hard for any government to do it all by themselves. So partnerships with private sector do become very important in our context. But somewhere the government has to steer that, because it is the government which is working for the public interest. If you look at a private sector, ultimately they have a bottom line, ultimately they have a profit that they have to make.
Yes.
So you can't leave it to them. You cannot even say in healthcare, okay, I'll just leave it to the private sector. You cannot do that. You can use their skill sets. You can use their ability to maybe scale up, to implement, to do things efficiently, by all means. Some of them have very cutting edge technologies. So yes, by all means, one should use those strengths. But I think the steering of addressing this inequality has to be done by the government.
गर्भावस्था के दौरान महिलाओं के मानसिक स्वास्थ्य को आप कैसे समझते हैं? इन समस्याओं के लिए हम उन्हें कैसे अवेयरनेस कर सकते हैं?
तो मानसिक स्वास्थ्य बहुत ज़रूरी है हर सिचुएशन में, लेकिन हाँ ज़रूर उस पर्टिकुलर कंडीशन में तो और भी ज़रूरी हो जाता है. अभी मुझे लगता है कि ज़्यादातर जो हमारी सर्विसेज रहती हैं, जो एंटीनेटल सर्विस होती हैं या पोस्टनेटल भी होती हैं, वो इस एस्पेक्ट पे नहीं फोकस करती. वो ज़्यादातर महिला का जो ओवरऑल बेसिक स्वास्थ्य है या उसका न्यूट्रिशन है, लेकिन जो मेंटल हेल्थ है उसको इतना नहीं अभी इम्पोर्टेंस दिया जाता है. क्योंकि जैसे आपने कहा कि गर्भ अवस्था ऐसा समय है जब एक अज्यूम किया जाता है कि महिला तो खुशी होगी, मतलब उसको तो कोई प्रॉब्लम मानसिक रूप से हो नहीं सकती है. और मैंने बल्कि एक थीसिस की थी अपने जब मैं पढ़ाई कर रही थी कैम्ब्रिज में, पोस्टनेटल डिप्रेशन पे, कि कितनी महिलाएं हैं जिनको उस गर्भ अवस्था में और उसके बाद डिप्रेशन होता है, और उनको बहुत तरह से जज किया जाता है, क्योंकि उनको ये लगता है कि अरे भाई आपको तो बच्चा हुआ है, मतलब आप कैसे दुखी हो सकते हैं. लेकिन लोग समझते नहीं कि ये तो बहुत ही कॉम्प्लेक्स इशू है. ये वो नहीं है कि वो दुखी है ऐसे ही, या वो खुश नहीं है बच्चे के साथ, उनको एक्चुअली एक मेडिकल इशू है. तो आई थिंक वो अंडरस्टैंडिंग अभी भी हमारे यहाँ कम है, और वो कैपेसिटी उस बात को समझने की कि फैमिली भी समझे उस बात को, क्योंकि कई बार आपकी फैमिली आपको जज करने लगती है कि आप कैसे दुखी हो सकते हो उस सिचुएशन में, आपको तो बच्चा हुआ है, आपको तो बस खुश होना चाहिए. सो आई थिंक उस लेवल पे हम आए नहीं हैं. बहुत बहुत इंपॉर्टेंट इशू है. एंड आई थिंक मैंने भी जब काम किया था कि हम अपनी एंटीनेटल जो सर्विसेज हैं, पोस्टनेटल सर्विसेज, उनमें कैसे सुधार लाएं, तो मैंने इस विषय को रेज किया था उस टाइम कि जो मानसिक किसी की स्थिति है वो ज़रूरी नहीं है कि वो खुशी हो या सब उसके लिए अच्छा जा रहा हो. क्योंकि आप देखिए कि एक माँ के लिए वो समय कितना मुश्किल भी होता है, कितना चैलेंजिंग होता है, आपके बॉडी में कितने चेंजेस हो रहे हैं. तो साथ में आपके माइंड में भी इश्यूज आ सकते हैं, जो कि मेंटल और फिजिकल हेल्थ तो बहुत ही करीबी रूप से कनेक्टेड होते हैं, दोनों चीज़ें अलग नहीं होती हैं. तो आई थिंक उम्मीद है मुझे कि जब आगे अब हम इन सर्विसेज को, सुविधाओं को इम्प्रूव करेंगे, और जो हेल्थ एंड वेलनेस सेंटर पे भी हम काम कर रहे हैं, तो हम इस एस्पेक्ट को भी देखना शुरू करेंगे कि महिला सिर्फ वो फिजिकल, शारीरिक रूप से वो बस स्वस्थ ना हो, लेकिन मानसिक रूप से भी हो.
In rural area, many girls drop out due to poor sanitation facilities in school. So how can we address this issue?
Right. So very good question. And I think, like was mentioned in the introduction, that of course we've made a lot of progress with Swachh Bharat, even though numbers might not be 100%, but okay, we have made a lot of progress in terms of the hardware. Now, there's one issue. Firstly, with the hardware, you have to maintain it, right? And so a lot of the facilities, what happens is that you'll find, because I've done surveys in schools where I have gone just to check the wash, aspects. And
yes.
The toilet is there, but it's locked. The key is put away somewhere, or there's no soap, there's no running water. The toilet has just fallen into disrepair. So I think those are real challenges with the hardware, that just building a toilet is not enough. Unless you ensure that it is actually fully functional, it is clean, it is usable, and it is accessible. I think that is also very important, because I think a lot of our disabled people, men and women, they are still unable to access toilets because simple things like a ramp are not there, or they are broken. So I think firstly on the hardware, we have to pay attention to all of those aspects, and especially the maintenance part of it. And then comes the software part of it. And I think the software with girls, because, you specifically mentioned the issue of girls. The reason why a lot of that dropout happens is because of the menstrual hygiene related issues. So when girls hit puberty and when they start menstruating, then a lot of them find it very difficult to, keep coming to school. Because sometimes it will be something as simple as that the toilet doesn't have a latch, or just doesn't have any facility to, dispose a sanitary napkin. So then the girls stop coming, and then we have this massive dropout at that time. So I think we still have a lot to address in terms of the menstrual hygiene management, right from the hardware aspects, where of course, you should have access to the sanitary napkins, you should have infrastructure to dispose the sanitary napkins in a safe way, in an environmentally friendly way, because that's also a big increasing concern. And of course, you should have that education, that kind of menstrual hygiene education, bring about that behavior change. Also, again, remove any stigma that might exist, any taboos, because they still exist. For us, it might seem like a very unreal thing now, but if you go to many parts of India, you still have all sorts of myths and misconceptions about menstruation, and girls should not step out of their homes, or even in their homes they should just remain in a room isolated from everybody. So there's all those kind of issues that still exist that we need to address. So I think addressing that dropout issue will mean tackling both the hardware and the software issues.
Ma'am, before we go to next question, here I would like to bring one thing. In Tamil Nadu, I have seen that some panchayat, they have installed the incinerator. Will it be possible to scale it up with the entire country, or what is the status? Dispose the sanitary napkins, used napkins.
Right. Yeah, I mean, I think southern states are ahead of the curve in this, like in most other areas. In the north, we are quite far from, being in this situation. But I think, yes, so the idea with scaling up always is that whatever solution we have, whether it's that machine or some other solution, it has to be cost effective. I think that's the most important thing. Of course, it has to work, but it has to be cost effective. It has to be easy to use, easy to operate. If it stops working, then what do we do? Because at scale, I think, because I've been in the government, I've been in the policy making, these are the questions you're always asking. So whenever an innovation also comes to us, these are the questions we're asking. That is it scalable? Is it cost effective? Is it easy to use? Is it easy to maintain? What happens when it stops working? What is the process, for handling it? So, because I think we're trying to do so many things, and we're trying to do it at massive scale. So if something is even a little more complicated, then if that whole ecosystem, that state is not ready, to implement that, then you will not see the scale. And that's why we end up seeing a lot of pilots, but they don't scale up somewhere, or they don't sustain. Because, maybe a pilot succeeds because you have a third party. Maybe a CSR came and helped you. Maybe an NGO helped you. But I always ask that question, that what when that NGO goes away? Or what when those CSR funds stop? So then how do you sustain that? So I think for that, it's a broader question of, of course, realizing the importance of why we need it. That is the first step, obviously. But the second is a more operational issue of, when I need to do something in an Uttar Pradesh, for instance, right? I mean, Uttar Pradesh, I always say, it's not a state, it's a country. Look at the size, sheer size,
The density of the population.
So if I'm kind of sitting there trying to implement anything there, it's a huge issue. And so unless it ticks all these boxes, it becomes difficult to scale it up. So I think these things will happen, because again, on menstrual hygiene, I've seen some positive movement also in terms of even just the conversation on why it's important. So I think eventually, hopefully it will translate. But the issue is, of course, we need to do it quickly. We don't need to be so slow, and so we need to have partnerships, we need to have civil society, corporates, everybody pitching in, because if we leave it to the government alone, then that kind of scale will take a lot of time in many states. And that's why I said I'm not looking at a lot of the southern states like Tamil Nadu, Kerala, which are already very ahead of the curve, on health, on education, on hygiene. But I'm really talking about some of the northern states, especially where we have a very, very long way to go. So I think that is why the partnerships can just help make things faster.
Thank you. We can now take the last question.
Ma'am, income is a very important factor for women to be able to exercise agency. How can we improve LFPR for women in India?
Yeah, that's a huge question. I mean, we could spend an entire day talking and more talking about it. But so again, the labor force participation, I think it has many different dimensions. Of course, there is the education and skilling part. Like we said, a lot of girls, they might be even completing primary education, but then dropping off, somewhere at secondary school. So what happens to all those girls? Do we have any skills that we are giving them? And then even if we are giving them skills, are they getting any gainful employment out of that? Or are they becoming entrepreneurs of a certain level, where they have a decent income, where they can at least sustain themselves? So I think that is one whole gamut of challenges. The other is, issues like safety. In a lot of the urban areas, the reality is that it is very difficult for women to be out, of their homes, especially later in the evening or at night. We have this whole debate about night shifts of women and what are employees doing to make it safer for them. Because the fact is that, even our cities are not, or most of our cities anyway, are not safe. And so there's always that concern at the back of the mind that, can I do this? Can I do this night shift? Can I stay out late? So I think that whole piece is there, something as simple as having better street lighting, having better, safer public transport will help all of that, because then women will feel more confident that, yes, I can go out at night or I can work late hours. Because sometimes I think women lose out in that also, because they feel they can't do that. Then I think a big issue really for women is the whole, when they get married, they have children. That is the one other big point where you see women just dropping out of the workforce. So I think what can employers, what can companies do to make that kind of transition for them easier, and better, and not just put them in a position where they have to drop out. So childcare, for instance, the creches, everything else that you can do to help, or paternal leave or family leave, as now increasingly we talk about that, why should the burden of childcare just be on the woman? What about the man? What about the partner? So that is there. Then I think finally, I would also say that this came out in one of our economic surveys, I think a few years back, where they noticed this interesting trend that as the household income was improving, there was almost less pressure, on the woman to work. And so a lot of women were kind of falling back into those conventional stereotypes of not working, because the household income is enough. What your husband is earning or general earnings of the house are enough. And so you don't need to work. Right, so that also comes back to the stereotypes, the mindsets that we think that a woman should work only when it is necessary. When she has to contribute, to the economically to the income of the household. Yes. But when we feel that no, it's not really needed, then the woman need not work. So I think that is a big challenge. In a lot of developed countries, they notice this trend. And I think somewhere that is also happening with us. So there might actually be a counterintuitive kind of trend, because you might feel that, okay, household income is going up, education levels are going up, so women should be working more. But actually the reverse might end up happening. So I think for that, like many other things, we have to tackle the mindset. And we have to kind of make it clear that women are not working just because, you need them as a breadwinner. They're working because they have something to offer. They have something to contribute. and their voice is important. So that's why they're working. And then secondly, you need to make it easy for them to work. In terms of safety, in terms of, the whole childcare phase and the transition. And so I think all of this has to be kept in mind. I mean, you look at the maternity legislation, we brought it in, but actually most companies complain about it. They say that, we don't want to give, women this kind of period of leave. So I think till we have such mindsets, we'll make it very difficult for women to work. So I think, one, we need to change our mindsets. And two, we need to give them a better enabling environment because, like I just said, and I'll conclude with that, we are investing in women and girls not just for social justice. We are investing because we want our companies to do better. We want India to become developed. We are investing for workforce, for economy, for GDP, for all these reasons. So it's not a favor we are doing to a woman if we are giving her, a few months of leave or, some kind of maybe adjustment that she might require, because she will contribute and bring a lot to the table.
Thank you so much. And I must say, it's truly an interactive session. And you started with policies, programs, then diseases, cultural factors. Then we did discuss about reproductive rights, then health, sanitation, menstrual hygiene, women in leadership position, mentoring, and what kind of behavioral changes we need. And I think now we are coming to the end of the session, and with this, on the behalf of our School of Gender and Development Studies, we thank Ms. Prasad for discussing such complex issues of gender in the context of public policy. And your talk has generated a critical and analytical thinking among our learners on cutting-edge issues which they are currently working either for their MA dissertation or project or for their PhD thesis. We hope we can achieve gender transformation through implementing different kind of gender-just policies and creating a cohesive environment along with a consciousness or awareness. And here, education system or higher education plays a very important role. With this, we would like to express our thanks to Ms. Urvashi Prasad for sparing such valuable time to be with us and learners and IGNOU fraternity and sharing her experiences. And with this, we come to an end of this session. Thank you so much. Thank you.